The maiden doses of the Sinopharm COVID-19 vaccine are administered today in Yaoundé with a distribution plan of 10 regions outlining that 100,000 doses will be for health workers and vulnerable groups. The third term of the 2020-2021 school year begins with school authorities bent on completing the work syllabus and ensuring the success of learners in official exams amidst the COVID-19 scare. Muslim faithful prepare for the 9th month of the Islamic calendar, the Ramadan, observing and reflection on the spiritual preparation in mosque hours ahead of moments of devotion in this newscast. Good evening and thanks for joining us. Those were the headlines of the 7:30 News.
I urge you once again to put on your face masks, to wash your hands regularly, and to consult a physician or any other health personnel if you notice any symptoms. This is the only way to save lives and to curb the spread of the virus.
We begin our half-hour newscast with this good news. The first shots of the Sinopharm COVID-19 vaccine donated by the People's Republic of China to Cameroon have been administered today. The doses of the vaccine, reports say, have reached most regions of the country. The distribution plan shows the demographic setup of nations and the number of key workers and vulnerable persons targeted. Beatrice Law Samba unveils the scheme in this report.
Cameroon's distribution plan for vaccines has been applied from the time of the arrival of the Sinopharm COVID-19 vaccines Sunday, as vaccine experts say they are careful not to waste a dose. The vaccines were safely moved from the port of entry. A day after arrival, they are on their way to the 10 regions of the country for delivery.
The dispatching is based on the demographic data of different target population in the region. And then we also took into account the staff of a health professional. For the center region is about 26,000 for health professionals.
In the regions, the distribution plan is clear. The vaccines destined for 189 health districts will end up in 522 vaccination centers and target key workers and vulnerable persons.
The objective is to reduce the pressure of the pandemic on health services, workforce protection, and then the reduction of hospitalization to reduce excessive consumption of health services.
The COVID immunization rollout will be the country's largest. This first vaccine shipment is enough to inoculate 8% of the population most in need of protection, and is the critical first step to ensuring the country's regions get equitable access to vaccines.
The main objective of the vaccines in the country is to halt the spread of the virus and to prevent people from getting sick with COVID-19. The expanded program on immunization affirms that 100,000 persons in the 10 regions will be vaccinated. The target is 20% of the population while awaiting the arrival of other boosters. Cynthia Saptala reports.
It is 200,000 doses of Sinopharm COVID-19 that is being administered to Cameroonians in 2 doses, with the second shot given 21 days after the first. That means 100,000 people in all the 10 regions are being targeted, mostly frontline workers.
We will begin vaccination with healthcare workers who are more exposed to the virus. We hope to attain all medical professionals with these doses of Sinopharm.
So in the 10 regions, the center, littoral and far north regions are expected to receive the highest number of vaccines, given these are the regions which have recorded the highest number of COVID-19 cases. And based on health officials, the national plan for distribution targets 20% of the population, which will be achieved successively with the arrival of new stocks.
We have already identified priority groups in the population, those with underlying medical conditions, considered high-risk individuals, and they are estimated at 800,000, that is 3% of the population. Those considered as showing moderate risk, and then those above 50 years old.
The immunization process is expected to go on for at least 3 years in order to get the entire population vaccinated.
The Sinopharm COVID-19 vaccine comes at a time when coronavirus infections and deaths are skyrocketing in the country. In 4 months, the number of deaths has doubled and now stands at over 900. Killian Dandifon investigates on the probable reasons for this hike, which ranges from disbelief to irresponsible attitude towards barrier measures.
March to December 2020, Cameroon recorded 428 COVID-19 deaths. But just 4 months in 2021, the number scales to close to 1,000. Where is the missing link?
When we move into the market squares, we see that the population mingle among themselves. They have no face mask, don't wash their hands. We don't find washing containers placed at the entrance of certain marketplaces.
At the entrance of each school, you see a bucket, water, everything soap. But inside the classrooms, the students are still very choked up in the various classrooms. Although they pretend to say the numbers has been reduced.
The message of the head of state is impacting Cameroonians.
The head of state is a person to tell us what to do. And right now he's saying that we should wash our hands, wear our mask, and then go to the doctor just in case symptoms appear. But screening centers create all the problems. People are afraid, and you know that the fear for the disease is worse than the disease itself.
Sensitization also already convincing many should roll on.
Health experts all over, they move around talking, conscientizing the population.
Il y a le volet prévention qui concerne le respect des mesures barrières, la distanciation sociale et le lavage constant des mains.
All these notwithstanding, the best way out of COVID-19 is the respect of barrier measures. And finally, the vaccine already at the disposal of Cameroonians.
The Central region alone now counts 1,391 active coronavirus cases since the closing of all makeshift centers to cater for patients except the specialized center for COVID-19 treatment at Okar Yaoundé in July 2020. Managing victims has been arduous for health workers. Yoti Kaleli Songa reports that the loan facility is today overwhelmed by the demand.
Until the second wave of the coronavirus came hitting hard in Cameroon, it seemed like such a brilliant idea to close all COVID-19 makeshift centers. But for the Annex No. 2 of the Yaoundé Central Hospital, its 283-bed capacity left the health workers overwhelmed and infected persons in search of health care as the number of active cases increased.
During the month of January, February and March, there were so many cases that all the beds were full of patients. The ministry decided to reopen the other centers as Jamo. Actually, we have 45% of occupation of beds in Oka. So till now we can say that there is no more pressures.
90% of positive cases are so far on home care in all 30 districts of the Central region.
We have teams of districts and for some big hospitals who are taking care of those patients in their houses.
Health workers are counting on the population to keep respecting barrier measures so that the COVID-19 spiral can be stopped.
And in one of our top stories, the third term of the ongoing school year has begun effectively in most parts of the country with lessons dispensed on the first day. Cognizant of the health challenge, pedagogic inspectors have been touring primary and secondary schools to assess the implementation of orders on the safety of learners and instructors. Romeo Kenny tells us more on the 7:30 News.
The race of the last and most crucial term has just commenced. Anti-COVID-19 measures are not ignored. At least the wearing of face mask is obligatory in Government High School Mbala 2, but social distancing is iffy. These girls probably forgot plaiting their hairs over the weekend. Hand washing is a must in along other COVID-19 measures, and pedagogic inspectors have come verifying.
The hygiene, sanitation is good, the school is clean, but they still have much to do with the wearing of masks. Yes, there is soap. When I came, I told them, that I was here at 7:30, that they should have soap, savon, and water.
In this private institution, anti-COVID-19 checks are done right in classrooms.
We are continually reinforcing and putting in place the COVID-19 barrier measures of constant wearing of masks, washing of hands with soap, running water and soap, and using hand sanitizers.
80% of syllabuses have been covered and revisions have intensified in examination classes.
They will be here just for 6 weeks, and within these 6 weeks, they must round up the syllables.
I plan to use 1 week per subject for reading, 1 week per subject, and maybe in the afternoons try to brainstorm a bit on some other revision questions.
The third term officially draws its curtains on June 25, 2021.
In the South region, school authorities have strengthened measures to ensure that discipline reigns in all institutions as learners begin lessons. Their mission is to make certain that the curriculum is respected and completed before the start of end-of-year and official examinations. Polikapati has the details.
After a 2-week break, pupils, students and teachers go back to school. After checks at the school entrances, the learners, characterized by enthusiasm and determination, have been prescribed discipline and hard work as instruments to counter the challenges that await them this term.
It's a decisive term because the children have to be preparing for examinations, that is moving from the lower classes to the higher classes, and also official exams like the common entrance and the first school, which are coming up in May and June.
For this to happen, the learning environment needs to be conducive. Thus, measures have been taken to ease the process.
We are sensitizing the children so that they should keep on putting their face mask and then sanitizing their hands and regular washing of hands and social distancing. And we have avoided grouping children for more than 50. That's why this morning we are rather passing the announcement but in the classrooms.
The third term, to last roughly 6 weeks, is the shortest and most decisive in the school year as it leads to promotion and certificate examinations.
From our news reports in the South region, we'll take you back to the nation's capital, Yaoundé, where the basic education sector is committed, as those of other levels, to see pupils study in a milieu free from the coronavirus. At the central government's English primary school, Yaoundé, the respect of preventive prescriptions is evident. Beatrice Ngum reports that hand-washing sports are spread out on campus and masking up is obligatory.
A queue of pupils trooping into their school campus on this first day of the third term. Faces mask, a hand-washing bucket welcomes them at the entrance. The head teacher keeps watch. Hand-washing is obligatory.
All COVID barrier measures were taken into consideration. We have the washing hand buckets with the soap. As the children get into the campus, they wash their hands before they get into the classroom. The school was first disinfected.
The pupils are stepping into a classroom disinfected the night before. From class 1 to 3, school officials are less rigorous on the wearing of masks, considering their age. But for class 4, 5 and 6, it's no face mask, no admission into the classroom. And unconventional masks too can serve as a pass into the class. Parents are sensitized.
Each class has a parents forum, WhatsApp forum. So yesterday in the morning, I wrote a message to all the various classes for the parents to make sure that they prepare the children with their face masks while they are coming to school.
A campus-free virus equally entails respecting the quota of 2 per bench.
Children with special needs have also begun classes for the last and decisive term of the school year. Sufferers of autism and other mental disabilities catered for at the inclusive nursery and primary school in Yaoundé have their instructors present to supervise their work and to enable them overcome their condition. Gerard Nanji Eyambe tells us more.
First day of class in the third term, little Priska, who suffers from autism, finds herself with her classmates. Her autistic handicap is better handled since she began attending this school, including those with mental retardation, such as little Marie-Rien.
She's trying to have the same level with those who are normal.
We discovered that there are some children who are having difficulties in writing, so that is why we had to go deep to really find out the difficulties of these children. Children of special needs, some of them have been traumatized due to the situations they face at home.
In this special section, pupils undergo training based on the needs related to their disability for 2 years.
I have to make a diagnostic. I have tests to know the level of the problem, the handicap. And after I'll see the method I can use. I use to work with the parent.
The school also intends to welcome more children with special needs in the years to come.
Despite our efforts, COVID-19 plunged many families into mourning and seriously hampered the functioning of our economy and society.
Medical practitioners have been putting their lives on the line to save the population from the ravaging coronavirus. With the arrival of 200,000 doses of Sinopharm, they will be amongst the priority groups to be administered the booster. For especially those in direct contact with COVID-19 sufferers, it is a huge relief. Baldwin Summer and Dr. Eric Tandy are at the Public Health Emergency Operations Center and now highlight the critical role played by health personnel in rolling back the pandemic. Hello, Baldwin.
Good evening. They have been playing an important role as far as taking care of COVID-19 patients ever since we had the outbreak of the coronavirus in Cameroon. They equally have been infected on several occasions. Let's find out from our guest, Dr. Eric Tandy. Good evening to you, Doctor.
Yeah, good evening, buddy.
Explain to us, it has been a difficult process for most of these health professionals. How have they been coping, especially those directly taking care of these COVID-19 patients?
Yeah, but then it's worth mentioning here that health personnel or all health professionals who have been at the front line have been highly touched as far as this is concerned. And they continue to, because we've not ended the fight. It's still ongoing. On daily basis, health professionals receive different categories of patients suffering from COVID-19, as you can know, especially in our different specialized centers. And the fight is that more and more patients keep coming in on daily basis, and this has caused the burden of activity to be more higher. But yet, we are not relenting our effort. They keep on providing this assistance to all personnel at all times. But what we need to emphasize here is that the care for these patients, the population needs to come in to support these patients or these professionals in the field. How? By respecting barrier measures.
Thank you so much, Dr. Eric Tandy, for your availability. We will continue appreciating the key role they have been playing, they play, and will continue playing in this national fight to limit the spread of the coronavirus in Cameroon. Back to you.
Thanks, Baldwin Summer. We're praying that these frontliners can be saved so that they can continue doing their commendable job. In other news, over 13,000 young Cameroonians are aiming for a place as non-commissioned officers and as rank and file in the Central Region. The minister delegate at the presidency in charge of defense, Joseph Betia Somo, was at the Yaoundé Omnisport Stadium where the exercise is going on and called for transparency in the process. Albert Njembonde has the details.
From as many as 13,800 registered, only a few of these candidates will be chosen for an exercise that has 4 working groups. First, the Department of Human Resources, where Joseph Betty Asomo was assured that 70% of the candidates have been screened, with a significant proportion from the Northwest and Southwest regions. Then the working group of the Division of Military Security that is keen on the regularity of the exercise. The minister is briefed on some cases of corruption, mainly from parents that were severely reprimanded. Here, the identity of every candidate is highly scrutinized. Then the health working group. All the senses are tested. Screening on pathologies not compatible with military service are equally screened. Joseph Betty Asomo's last stop was in the working group of sporting activities, another hurdle where the difference will be made. The defense boss, before leaving, urges his collaborators to watch against each cheats, corruption and favoritism of every kind, calling for zero tolerance against those attempting to integrate the defense forces through the back door.
And still in security news, 3 bridges of Keshang, a village in Akwa subdivision of the Southwest region, have been rehabilitated by the 6th Rapid Intervention Battalion of the Southwest region. Amongst the bridges, the forces say 2 were destroyed by non-state armed groups. Tanjong Levi Sagbo has the details.
15 meters away from Manfi through a narrow path is Keshang village in Akwaya subdivision. Defense forces eases mobility in rehabilitating 3 bridges here. A village just like others in the subdivision facing difficulties in terms of accessible road.
Those bridges is for you. You have to organize yourselves to secure those bridges. Do you know how? No. Don't know. You have to help us by informations. If you are here about something, don't say that this information is not good, fine, it's not good. Just let us know that it's like that.
The task force has been in the village for a while, amongst others contributing to the development of villages which were bearing the brunt of armed fighters.
The destruction of these bridges impaired the movement of indigents since it interconnects life from one quarter to another. But now that the bridges have been fully restored, I want to say that the population can freely move to carry activities of their choices.
Health and nutritional assistance are also envisaged here. It is a happy population.
I am very, very happy with what the government has done today in Akwaya subdivision, especially in Kesham chiefdom. This kind of gesture of reconstructing bridges that were destroyed is a step forward towards peace.
This act of the elite military army is just in time for this vulnerable population.
In other news, the monitoring unit of the Economic and Financial Program Reform of CIMAC is meeting ahead of their 2-day conclave built for this Thursday. The experts will be addressing sub-regional integration and development projects in the course of the video conference. Luma Slim Davis has the details.
The experts of the monitoring unit of the Economic and Financial Reform Program of CIMAC met ahead of CIMAC ministers' meeting. It was an occasion to examine what has been achieved so far and strategize on future endeavors. The president of the follow-up unit of the Economic and Financial Reform Program, Antoine Ngakanyi, lauded member countries of CIMAC for putting up resilience and a riposte plan nationally against the propagation of the coronavirus pandemic. This, he said, was possible with the assistance of the financial and technical partners. He noted that at the commemoration of the 12th edition of the PREF CIMAC Day, President Paul Biya, who was sitting president of the heads of state, said the putting in place of the economic and financial program of CIMAC permitted the re-establishment of the fundamental equilibrium and that the financing of integrated projects is going smoothly.
Religion Muslim faithful in Cameroon are dressing up for the 9th month of the Islamic calendar, the Ramadan, observed in prayer, fasting and reflection. In the far north region, spiritual preparations are gaining steam and the faithful are now engaging in the forgiving process while awaiting the start of the period in a day or two. Henry Tato Ekambi reports.
As days gradually die down to hours for the commencement of this year's Ramadan, Muslims are drawing the curtains spiritually to welcome the month-long fasting.
We are now asking our neighbors to forgive us. We are preparing to pray for peace to return and the end of COVID-19.
The Muslim clergy are also exhorting the followers of Muhammad to engage in some spiritual exercises to make the most of the holy month.
Every Muslim should repent from his old sins. It is very important to multiply the acts of devotion, the acts of worship.
Whether the fasting begins this Tuesday after the sighting of the moon or on Wednesday if the moon is not seen, the Muslims we spoke to here say they are ready spiritually to tap from the blessings that come with this 29 or 30-day fasting.
Women and girls in the Adamawa region also prepare for the holy month. They've enriched their knowledge on information and communication technologies. This is thanks to the African Institute for Computer Sciences. The resident representative of the institution, Claude Abanda, handed over and, of course, attestations to the trainees in Meganga in Bere Division. Rekiatu Musa Jengi was there on our reports.
Drawn from different walks of life, ethnic origins, religious beliefs and political ideology, the 100 laureates received theory and practical training on ICT basic and advanced knowledge, which most of them say has not only improved on their digital knowledge, but will help in job creation. We started with Word, then Excel. We were taught how to calculate figures and how to type. I have improved on my skills in technology. There are many things I can do now, like typing. I can now type without going to a cyber cafe. EIE Cameroon, through the operation 1 million young people, children and women trained by 2035, so far has offered ICT skills to 350,000 youth and women in Cameroon. The resident representative of the African Institute of Computer Sciences, Claude Abanda, praised the laureates for the steadfastness during the training. He went on to call on them to use their knowledge acquired to develop their community. He equally encouraged them to keep practicing, given that education has changed dramatically with a distinctive rise of e-learning, whereby teaching is undertaken remotely and on digital platforms.
And now in sports, the indomitable Lionesses of Cameroon will clash against their counterparts of Chile in the return leg of the qualifiers of the 2020 Tokyo Olympic Games tomorrow. The Lionesses, who were defeated 1-2 last Saturday in Antalya, Turkey, have the obligation to win the South American flag bearers to secure a ticket for the Games. They will have to take advantage of the weak defense of their contenders to score as many goals as possible. And that will be all for this edition of the 7:30 News, in which you mainly heard that the maiden doses of the Sinopharm COVID-19 vaccine have been administered today in Yaoundé, with a distribution plan for the 10 regions outlining that 100,000 doses will be for health workers and for vulnerable groups. You'll be in the company of Adel Mbala. I'll be back tomorrow at 7:30 p.m. God willing, stay tuned to our programs on CRTV and on CRTV News and stay protected from the coronavirus. Thanks for watching. Good night.
I urge you once again to put on your face masks, to wash your hands regularly, and to consult a physician or any other health personnel if you notice any symptoms. This is the only way to save lives and to curb the spread of the virus.
CRTV News, ici, toute l'info.